Hello, good afternoon. This is Dr. Larry Kidd at Henry Mayo Newhall Hospital. I'm joined again by Dr. Bud Lawrence, emergency room physician, and we're doing a follow-up from the review that we did yesterday regarding the COVID-19 processes and addressing your questions. And there were a number of questions on yesterday that we were unable to get to. And as a result, we're going to try and cover several of those today. And I will be starting off with the question related to the testing results for COVID-19. There were several questions related to how long does it take to get the test back, and what is the process once the results come in? How are individuals notified? So the test currently takes about 4 days on average is what we're seeing in terms of from the time the sample is delivered to the lab. Part of the time frame has to do with the number of tests that are now being sent to the various labs, such that it is taking longer to get the results back. So average about 4 days right now. Once the results are received, if there is a positive result, of course the individual being tested is notified of that result and provided instructions on follow-up, as well as the county health department is notified, and they initiate their follow-up with that individual. If the test is negative, of course, that individual is notified, and of course they are no longer required to self-quarantine, but also will continue to monitor for symptoms and so forth going forward.
Excellent. And my name is Bud Lawrence. I think probably we met yesterday informally. I am the medical director of the emergency department here at Henry Mayo. I'm an emergency room physician. And along with Dr. Kidd, we're going to hit some of these questions that were proposed yesterday. Also, feel free to type your questions in today. I think we're going to make this a fairly, for the short term at least, regular engagement where we answer your questions. I think this is a great way to reach out to the community. So one question that was not asked but was just updated last night, I believe, was the new recommendations for patients for when are you cleared? When are you done with having to have home quarantine if you somehow tested positive for COVID-19? And the answer to that is it has become, it's getting increasingly less, which is great news in the sense that before you had to have 2 negative tests greater than 24 hours apart. Then they took it down to 14 days after the onset of illness. It is now, if you are 7 days from the onset of your illness, if you're 3 days after your fever has gone and your symptoms are improving, whichever of those 2 amount of days is longer, that's how you're going to know if you can stop your quarantine and you're essentially safe to be out and around. Although again, we do recommend social distancing, and for the time being, at least for the short term, if possible, try to stay home. The more you're in your house, the less this virus can make its way around our community.
One of the questions had to do with whether or not individuals need to wear protective masks, and if there aren't masks available, where do they get them from? So as Dr. Lawrence just indicated, the way to avoid being in contact with this virus is to stay in your home, to avoid being in public gatherings, frequent hand washing, to try and keep your hands clear of any virus, not just COVID-19, but proper hand hygiene is something that should be done by everyone at all times. It is not necessary to wear a mask in public, and for that reason, individuals should not be worried about protecting themselves by using masks. But social distancing and all of the other recommendations that the health department has indicated, as well as CDC, are the best ways to avoid contact with this virus.
That's great advice. Here's a question probably not a good idea to answer a question that I don't know the absolute answer to, but it's a very important topic right now that's been out there is it safe to take ibuprofen if you have a COVID-19 infection? Now remember, like Dr. Kidd alluded to, that if you are sick with something, it's not there are many other viruses out there. It could be flu, could be anything. Tylenol and Motrin are great for pain control and fever control. There was recently some information out of France and the WHO saying, hey, listen, don't mix ibuprofen, which is the same thing as Advil and Motrin. There's just many names to confuse everybody. Don't mix that medication with a COVID-19 infection. At this point, that very well may be true, but we don't know that for sure, and I can't definitively say it's false. So at this point, the jury's definitely out, and I don't know the right answer on that, but I just wouldn't jump to any conclusions. Motrin or ibuprofen or Advil is a very good tool for pain control and fever control. I think there will be more information on this that comes out as everything evolves, and everything we're telling you today is as things evolve. So more to come probably on that, but it's a wonderful question.
There was concern expressed on a couple of questions related to our access to equipment. Do we have adequate ventilators? Do we have adequate personal protective equipment, such as the required and appropriate mask and so forth? And I'm pleased to say at this time we do have adequate supplies. We do have a number of ventilators that are available should we need to treat patients who have a more serious illness. So in that regard, we're looking pretty good right now, but we are also very cognizant of using our products judiciously, indicating where it's indicated to wear masks, etc., that we're doing that. But right now we're in pretty good shape.
And I'd agree with what Dr. Kidd said in the sense that we are a disaster resource center here at Henry Mayo, and I feel very comfortable and confident where we are right now with respect to our preparedness, our equipment, and our supplies. Does a person get infected if the virus is in the air? So this is a great question. Along with another point to bring up is how long does the virus stay on things like countertops and things like that. So yes, this virus is transmitted by droplets historically. So if someone coughs or sneezes, it is in the air, and where it's looking to go is into your eyes, your nose, or your mouth. So this is why we have recommendations, things like don't touch your face, don't rub your eyes, wash your hands, those kinds of things. So yes, this is transmitted through the air, but also those droplets can land on things like this table or like my shirt. So keep in mind the average time. These numbers aren't solid. There's not a ton of data out there, but it could be up to as long as 3 days on certain surfaces. Other surfaces, it's much less. It's an order of hours that this virus can survive outside of our body. But I do think it's advisable to clean surfaces. These are all the recommendations you've heard, and obviously wash your hands. But if it's in the air, it's a very good question. That is how you get it. So again, make sure if you are sick, sneeze and cough into your elbow or cover your mouth.
There have been a few questions that have come in regarding where to get tested. I think we spoke to this yesterday, that it's not always indicated for every individual to be tested. There is a screening process that's done before it's determined whether or not an individual needs to be tested. Currently, the recommendation is that the individual's primary healthcare provider, physician, office or clinic where they may normally receive their health care, that they contact that site first, and they will provide instructions. If they're not able to actually do the test and the test is indicated after the screening, then they will be referred to a site if they're not able to do that. And of course, here at the emergency room, individuals presenting, if it's indicated after screening, we are able to do that test. So based on criteria following the CDC guidelines, and the Public Health Department determines basically who is appropriate to be screened, of course, and then who would be tested.
Which is a great point too, just to touch upon the testing piece. we're very customer service oriented here at Henry Mayo. We want to make sure all of our patients have a great experience. I just want to manage expectations that if you come here wanting a coronavirus test for you or your loved one, we understand how important you and your loved one are, but unfortunately we have to really adhere to these fairly stringent guidelines at this point. I think at some point that more commercial testing will become available, and that will change. Again, everything is evolving, but for the time being, we really do have to adhere to these federal guidelines. Next question is, could a normal viral infection as a sinus infection or an ear infection escalate or make you more at risk to get COVID-19? So the question that's really being asked is, if I have another sickness, like another viral infection going on, and is that going to wear down my immune system in a way where I might get COVID-19 more easily than maybe someone else? Which is a great question, and we may have touched upon it before, but the reality is that the data that we have now is if you have a diagnosed viral infection, say influenza, the flu, you had a flu positive test, there is a less than 2% chance that you're going to have a COVID-19 infection along with that influenza infection. It tends to not combine with other infections. We don't understand that very well, and those numbers are based on a very specific population of patients, so it may vary within our community. But right now it seems to have, I don't even want to say having another viral infection would make you is protective, but it's less likely actually that you'd have COVID. So it's a great question, and there's your answer.
Okay, we've had questions around what services have we discontinued at the hospital, what things are we no longer doing, such as elective surgeries and those kinds of things. Those elective procedures, etc., are based on a combination of the physician's evaluation of the patient, whether or not it is something that needs to be done urgently. If that is the case, it usually moves ahead. Otherwise, there are a number of other things that are diagnostic in nature or preventative that might be deferred to another date. In that case, that patient is rescheduled, and we're certainly able to accommodate if the patient chooses to have these things done at a different time. But anything that's urgent in nature, our physicians are always consulted, and we work with the patient and physician to determine the most appropriate time.
Excellent. A common question we got multiple variations of comes from our cancer community here locally, and they're concerned, I had lung cancer, I'm a lung cancer survivor 10 years ago, or I was on chemo 6 months ago. Am I high risk? So it's a great question. Again, we talked about on our previous Facebook Live that people whose immune systems don't work quite as well as they should are at higher risk. That said, you as a cancer patient, cancer survivor, your story is individual to you, your immune system is individual to you. I would say if you're a cancer patient and you're currently undergoing chemotherapy, I would say yes, you are likely at higher risk. This is a question you'd probably like to ask your oncologist. I'm not an oncologist and I don't know your specific results. But if you certainly are currently undergoing chemotherapy or have some other medication that you're taking that could decrease your immune system, things like steroids or other immunosuppressants, you could be considered higher risk, and you should be very cautious and really practice social distancing and all the things we talk about. If you had cancer many years ago, it's very possible your immune system is back to baseline and you may not be as high risk. But these are great questions. I would direct them to your oncologist for a definitive answer based on your particular situation.
We've seen questions come in related to concerns around individuals that are having to continue to work. They're providing support to our community, such as people that are working in the grocery stores. They're still stocking shelves and those kinds of things. So with that, there are guidelines that are provided again by the health department, CDC, and as a result, those organizations follow those guidelines related to hand hygiene, and any other types of preventative measures that are required. But for the most part, individuals in the community that are still working in the service industry, they are trained and they are following the guidelines that are put out by the agencies that govern these things.
So another great question that came up is, what is HIPAA? What is, can I explain or can we explain HIPAA? So HIPAA it's a health information privacy legislation. So basically what it is it's a law that's out there that says, hey, if you're sick and you need medical care or you receive medical care from somebody, nobody should be able to really find out what's going on with you. That's your own private information, and it is personal to you. And that's something that really needs to be protected. So we don't have people snooping in your chart. You don't have your neighbors trying to find out why you might have gone to the hospital. It creates a lot of work on our end to make sure that everything is protected. Now that everything is electronic, in the computer, there's a lot of security that's in place and a lot of measures and countermeasures to ensure that your privacy is protected. But outside of the COVID-19 issue we're dealing with right now, it is critical to me as a provider that when you come to me, that we support you and that we protect your health information, and that's not shared with someone else. It's your business. It's no one else's. It should be shared with your healthcare provider, but your other community members should not know. And that's actually why we don't divulge any of this information to the public in terms of who's positive, questions about where do these people live, what kind of car do they drive. That's unfortunately not something that can be shared.
So it's been our attempt today to answer a number of the additional questions that came in yesterday that we were unable to get to. We invite you to check our website to get additional information. There are also a number of Q&As that are listed there as well. We plan to do a Facebook Live. Right now we're scheduled to do Monday, Wednesday, and Friday. And we will schedule it at this time. 4:45 is the planned time, and we hope you find this information helpful. And thank you for listening.
And please put your questions in the comments section so we have something to work off for the next time. Depending on what kind of questions we get, we may be able to take live questions, or we may just want to focus on answering your questions you put forward through to us today. I think it's important that we have an avenue of communication to the community, and that we're able to at least put some of your questions at ease. Thank you so much for listening in, and be healthy, be safe, and stay home if you can. Thank you.
Do take care.